Rolling.
So tonight is the boring lectures, sorry, but it's the basis lectures. A lot of this you're already gonna know, some of it you may not. We may go over some abbreviations and stuff that you don't know. I'll give y'all a list of abbreviation and mnemonics that are helpful, just so you have copies of them, because I can't tell you how many times someone will look at me and be like, what did you say? Because they have no idea what was said. Like, I work at 911 as well. The first time somebody called Ross, everybody in the room turned around, Christy, what's Ross? If y'all, that's what I want y'all to do. When you're doing your clinicals, make sure to look at the notes on the computer and see how some of the stuff is put in. But I'm usually pretty good at figuring out what someone has written. And every now and then we're all sitting there we're asking each other, what did you clock? Because nothing that you clock sounds anything remotely like what was put in the computer. Somebody clocked amio and they put epio or something one time. We had a dispatcher that I think she just smacked the keyboard and whatever popped up is what popped up. But, you know, it is what it is. So, this chapter is EMS systems. And it's just, a lot of you have had 160, right? I know you three have. Have you had 160? Have you done anything? Good. You're not biased. No, I'm kidding. But the systems run a lot the same. Fire department, and here's the thing, a volunteer fire department and a paid fire department, they run a lot the same. You know the difference? One of them comes home with a paycheck at the end of the month. I mean, that's really one of the big differences.
It might not be a lot, it's still a paycheck.
So, we're going to talk about the fundamental knowledge of the EMS system, some well-being of the EMTs, some medical, legal, and ethical issues that we'll see as part of this. We're going to talk about the history of EMS. I'm a reader. I love to read. If you don't love to read, that's fine. I actually read the book I'm talking about on audiobook, and it was about Freedom House, which was one of the first ambulances in America. The lady that wrote the original textbook was their medical director. I'll have to look up what the actual book was, but there's been some podcasts with some of them. It was an all-black service.
Nancy Caroline wrote Treatment in the Streets.
Yes, and she was their medical director.
Or Emergency Care in the Streets.
She wrote it as the guideline for them on how to be EMTs. So
that was the book I used when I went through basic.
I thought about it's still out there, and I thought about using it, but the AUS is a little bit more updated now. Nancy Caroline is at 9, and I think y'all have the 12th edition. So,
yeah.
But so everything we do in EMS is research based. You may hear me come in, you may hear one of the instructors come in, you may find something on Facebook. Hey, did you see that this is changing because of the research that was done? Think about it. Who knew that Narcan was going to be the big thing that it is now? That's all based on research. The changes in CPR. AHA updates their CPR guidelines every 5 years. The new updates coming out this year. I've got to go in and do my update on that. It's all research based. If there's what GEMS magazine, which is the Journal of Emergency Medical Services, it's actually an EMS magazine. They post research papers on their Facebook page all the time. So if you're ever curious, you can go look at them. So this is your textbook, and it should answer your questions. At least give you a basis for it. The one thing I want you to remember is that was written, and then you go out into the streets, and that gives you utopia. I can tell you, very rarely do you go out and you meet a patient that's exactly like what's in your book. I remember going to an edit and I'm like, this is what it should look like, and I'm like, I ain't never seen that look that pretty in my life. Nobody's heart looks exactly perfect. You're not going to go in and see a patient, I'll be honest, I've never seen a patient that's choking actually do the international sign for choking. Never seen one do it. But you're taught that that's the sign for choking, right? I've seen them coughing. I've seen them hitting themselves in the chest. I've seen them point, but I've never actually seen someone do this as they're choking. Mike, have you seen them do the sign for choking?
No, they're usually unresponsive when I get there.
Izzy, you ever seen anybody do them?
I've seen people like laying their arms around and like hitting themselves in the face because they're trying to knock something out, I guess.
I can understand hitting yourself in the chest and the face.
Any of y'all ever seen anybody actually do it when you were smoking party? You have? I'm impressed.
I did choke.
Okay.
Choke. I mean,
And you actually did that when you did it?
no, I used a chair that
Right.
took it out.
So, out of the 10 people in here, none of us have actually seen someone do what you're taught is the sign. Just, you know. So, I want you to understand the book is the basis of your knowledge, and then you have to build from it. After you complete this course, you are eligible to take registry. We do not have a state exam. You apply for a state license. We will do the protocols as part of this class. The new state protocols are coming out. We may not do them till the end, because they're not gonna go into effect until the end. But we will go ahead and cover the state protocols, and I'll issue a certificate, because the state may ask for that as part of your licensure. The state wants your national register card, a CPR card, and usually the protocol update, and your money. Unfortunately, you know, they're always gonna want your money. So, most states have 4 levels, we have 5.5 in Alabama. So, Alabama doesn't technically recognize EMR. But you can be EMR certified through National Registry and work as an EMR in Alabama. It's a gray area, unfortunately. We have EMTs, advanced EMTs and intermediates. Alabama still recognizes intermediate. We have paramedics. Critical care or flight medics are equivalent of each other, and community paramedic is in the protocols, but they don't really have
A place for 'em.
a big place for them right now. So this is why I say 5.5. EMR is a gray area, community paramedics a gray area, and we recognize intermediates and advanced. So that's where you use your 5.5.
There's not really a lot of intermediates, mostly they just go from advanced paramedic nowadays.
I can tell you,
I only know of one, and that'd be your dad.
we have 2 that work at Decatur with us, that do not teach anymore. Jack and Randy are both intermediates. So there are 3 in Morgan County that I know off the top of my head.
There's a couple at the fire department in Decatur too.
And a couple of the retired guys still have them. North Alabama has the highest number of intermediates in the state. And I think there's less than 50 in the entire state now, and about 30 of them are in North Alabama. So EMR is very basic training. Let me tell you something though, baby delivery is an EMR skill. You know what that means? I'm not delivering the baby. If you're on a clinical with me, you're gonna deliver the baby, I'm not. I have successfully not delivered a baby, I wanna keep that up. My partner and I have a deal. She doesn't wanna catch. No, I don't wanna catch, and she doesn't wanna cut, so she'll catch the baby and I'll cut the cord. But she doesn't wanna cut the cord and I don't wanna catch the baby, because I'm too afraid that we're gonna hit a bump and I'll throw her across the back of the head.
It's a thing.
Look, they're slippery when they come out, y'all.
Oh, look how.
And I kind of believe that, you know, what can go wrong will go wrong to me. I always add the to me at the end of that.
That would be my look.
Morgan County does not allow EMRs on the ambulance. Lawrence County does. Marshall might. A lot in South Alabama do. I will tell you that the North Alabama EMS system is a little bit more advanced than the South Alabama EMS system. I don't know why I'm not like that. So EMT, you have a little bit more that you can do. You can do AEDs, you can do airway adjuncts, you can assist with certain medications. insertions, in Alabama, you can do blind insertion devices and CTAPs. Yes, sir.
Why is AED an EMT skill? AED, rescue, anyone who's.
So, I'm gonna go with, in some states it's not, but it is in Alabama. Yes, everybody should be able to do it, but it's also, you can put a 12 lead on, you can't, interpret it, but as a basic, you can put 12 lead on, so we will practice putting the 12 lead on. You're not gonna learn how to do it. I'm gonna tell you to be able to look and say that's good, or that's bad. I don't care if you know what the exact rhythm is, but I want you to know if it's good or bad.
Bad schools versus good schools.
Advanced EMT gets to do IV therapy, they can do a little bit more medications, and they are getting some cardiac in Alabama with a few updates coming out. Paramedics, they do endotracheal, nasal intubation, emergency pharmacology, cardiac monitoring, cardiac interventions, needle decompressions, they are doing more and more, and then when you add the critical care to that, they can do the needle crikes and RSI, and have some more drugs in their scope as well.
Aren't they about to give y'all some more drugs?
Some of our drugs are changing in the protocol. They're changing some of the dosages. So, you're gonna have some reading assignments, you're gonna have some lectures and classroom discussions. I want y'all to ask questions, I want you to talk. If we get a little off topic, I will try and rein us in, but you're gonna learn as much from each other as you are from me. That is my goal, I want you to learn as much from each other. If y'all are on your clinicals and you have a case and you wanna come in and discuss that call, we'll discuss the call, because everybody's gonna learn from that call. You can say, hey, you know, after everything, I got to thinking, I think I should have done this, this, and this. And you might be like, well, no, I think you did everything right. You might be like, well, no, I see what you're saying, you might have done this. It's okay to second guess yourself, but don't get so caught up in second guessing yourself that you're afraid to do anything. I will tell you, after big calls, not so much the smaller calls, but after the big calls, I always am like, can I have done anything different? Especially if it had a negative outcome. Is there anything I could have done to have made some positive outcome instead of what we did? We're gonna do some step-by-step demonstrations. We will show you how to do the skills. You will show each other how to do it. And you will do them. EMS is a real proponent of the see one, do one, teach one. You're gonna watch us do it. You're gonna practice it yourself. You're gonna teach someone else how to do it. When you can teach someone else how to do it, that is when you are proficient. I don't wanna say you ever master a skill, because you should always be learning ways to be better with it. You may go home and practice on your children, they may hate you. You may go home and practice on your spouses, or your, parents, or whoever.
Don't go ninjing on your dogs or your kids.
It's a good way to learn. Your kids may get tired of it, I can tell you mine does, but, you know, she still gets drugged in here. And then case presentations and scenarios, like I said, there's some case studies in your textbook, in your online, but I may find some that I bring in. Like I said, if you run a call, I want you to be willing to talk about it. Especially if you run a call with one of us. Or Lane responds with the fire department, and you're on the ambulance or doing a clinical that day, and Mike's your preceptor. Let's talk about it. Let's see what the 3 different viewpoints of that were. Cause while Lane's in training, he's gonna see it more from he's limited, he's not an EMT yet, so he can only do so much. And you were in training, so and Mike's gonna see like a bigger picture. If y'all wanna ride with me, you're more than welcome to ride with me. I'm not making you even come to me. I'm just gonna throw that out there. But if you want to, you can. I mean, I'm not gonna stop you. A lot of people don't want to. You're not required to do them. If you want to ask when your trainers are doing clinical, so you don't ride with them, you can do that, and I'll tell you when we're on the truck, so you don't have to ride with one of us.
I can't ride with her anyway.
You can't, no, anyway, you can't ride with Reagan. But if you wanted to come in at 6 o'clock in the city, while she's at 6 o'clock in the county, so you're getting off at the same time, you know, whatever.
So
So like, Gunnar Wallen, he
You
does,
can ride with gun.
he
That's
does
fine.
I know he works a couple shifts,
Mhm.
and so like, can I schedule him and
Yep.
Hang on, I can schedule it in.
Yes.
You have to be with the medic lab.
No, you can do it in advance. Actually, you can be on a BLS truck if you want to, because you're gonna run BLS calls. Like I said, you're required 2 on the ambulance, 2 in the ER, you can do more. So if you wanna schedule a Tim, you can schedule a Tim, cause he is in advance. You can do just medic trucks, if you wanna schedule a ride on the basic truck, cause you're gonna get a lot of contacts on a basic truck, you're gonna do a lot of transports on a basic truck. But you know what, our dialysis patients are some of the sickest patients I've ever seen.
So don't knock your transports.
Do they get, annoying because you do them so much? Yeah, because you get behind on paperwork and stuff like that, but you see a lot of patients, you get to do a lot of patient histories, you get to learn how to talk to people. Cause really sick your 911 patients, they may not can talk to you. But your dialysis patient can probably have a conversation with you, you can find out a lot about somebody with that.
On your transports from hospital to hospital or hospital to home, you can hospital to wherever or anywhere to anywhere really. Especially do a hospital to hospital, you can get your patient history, you look at their medications, and you can tie in their medications to their history and see what. That's how I learned a lot of my medications. Before advanced school, before medic school.
I still look
That's
at
right.
medications in the back of the truck because I may know like the brand name and they give the generic, or I know the generic and they give the brand. I look them up all the time.
Yes, ma'am. I was wondering, that's gonna be clinicals at Greg's?
Yes.
Okay.
I'm just using examples.
I've never experienced the Decatur, that's why.
I would suggest you do just one at Decatur to see the difference between Decatur and Rex.
Okay.
I'm not gonna require it, I'm gonna suggest it. The hallway is a little different, and so it might just give you a different perspective on things. Like I said, I'm not requiring, and that's like, we Greg's, if y'all wanna be Greg's, you can be Greg's, it's up to you. Cause I know y'all run, you're on that area that you could actually run with either one.
that's that, we can,
Yeah.
we seminar every other day, so.
Yeah. Yeah. EMTs are the backbone of the EMS system. I'm gonna tell you right now, my medic partner has kept me from making lots of mistakes. Sometimes as medics, we get so focused on doing the medic stuff that we forget to do the basic stuff. And if you can't do the basic stuff, then you shouldn't be trying to do the medic stuff yet. So, I say that my truck is as strong as my EMT is. So, general requirements of the state, you have, in Alabama, you have to have a high school diploma for EMT, or the equivalent, or a GED. I don't think we require immunizations, they do recommend the hepatitis, and I will tell you, I recommend the hepatitis vaccine, that's the only one that I'm like, I recommend it, cause we never know what we're walking into, and y'all know that. I don't require anyone to get COVID, I don't require anyone to get flu, or anything like that, but I do think that hepatitis is a good one to consider. Beyond, your normal, yeah, you got measles, mumps, chickenpox, tetanus is another one that I'm gonna say you might wanna go ahead and get a titer if you don't have one. You have to do a background check and drug screening. The state does a background check, they don't drug screen you when you submit your place of employment, can and will. And a valid driver's license. In Alabama, you have to have a valid CPR card. It has to be AHA CPR because most of the services require AHA CPR. And then, a state protocol class.
Are y'all able to do that?
Yep.
Cause I'm expired.
We're going to do that as part of class. We got that handled, promise. Does Alabama require anything else you can think of, Mike?
No.
No, I did mine. I didn't even touch that stuff.
You do have to complete a required course, you do have to, take the registry test. They ask you questions that say, are you mentally stable? Who's gonna put that they're mentally unstable on that question?
Question, who actually is mentally stable in this?
We wouldn't be in this class.
One thing they do check, registry, if you have ever had, any type of felony, we might have some issues. And y'all, I had a student once that got a DUI for being asleep in her car and the keys were in the ignition, she was in the passenger seat, she got DUI, and we had to jump through hoops to get her to take registry. Did you know you can get a DUI for being in the car drunk even if you're not in the driver if you have access to the keys?
Mm-hmm.
Yep.
So don't,
However,
throw them in the back seat.
Yep.
Throw them in the trunk.
I have known people that have slept under the car, so they're not in the car. I was like, but then you're drunk in public.
I'll say that's probably.
And they're like, no, I'm under the car, no one saw me. I'm like, that's just weird. Why are you that drunk? And then your employer may have, certain things they want. At, Decatur, we either have to get the flu shot or sign a waiver for it. Most of the hospitals require that. During COVID, they were requiring you to either get COVID shot or, sign a waiver for it. There may be a couple other things. You have to do EVOC. We can discuss if y'all wanna do an EVOC class. I may just tell you when we're doing it at Decatur, and if you can make it, you can just come and take it with us if you want.
If we already hold EBD, we ain't gotta worry about it.
Is it
You have to have EVOC on the end.
EVOC is different for the ambulance, yeah.
I thought EVOC, EBD converged with the.
No.
The hospital requires us to have EVOC.
I thought they were doing away with EVOC, that's
Nope,
why
they
brought
changed
EBD.
No, they changed it and brought back EVOC. Yes,
Mine
sir.
is weird, but does Decatur Fire, do they do chemicals?
Yes.
I would love to do it. I
They
would
do,
love to
but
do it
I haven't
48
reached out to
times.
them, I can ask. I mean, I can ask Hartsel Fire if they want, if they wanna do clinicals, if that's something.
You talking about right now on the lifeguard?
Because 95% of firefighters are EMT now.
Yeah, it's just going downhill.
But,
And it's not.
I can't think of any other major provisions. They background check, they drug screen, they may come in and randomly say, especially hospital-based systems are different than private systems. Cause if the hospital decides you have to do something, then you have to do something, like at Decatur. If you got a job at Decatur, even though I've done an AHA CPR card with you, I have to check you off as a Decatur employee now. But you just have to come and do a skills check, or however we have to do that. So, whatever your employer decides. You do fall under ADA, the Americans with Disabilities Act, so they can't discriminate. Employers can't discriminate, the state can't discriminate based on disability, sex, religion, race, any of the stuff you can't discriminate for, you can't discriminate for, use your license. So, think about the origins of EMS. Where did EMS start?
Versus.
Before that?
Wagon.
Wagons where?
Out west.
You ready off the slide? Yes. We started from the military. So the military tests it, and then they send it to the civilian world. Or they keep it for themselves and they don't want the civilians to have it. But honestly, you will see if any of you have done, military medic or know any friends that are military medic, you'll see them doing something, and 4 or 5 years down the line, a lot of times we'll be doing it out here. Like the IO drill that started in the military. IVs in general started in the military, for street medics to do. So, they had volunteer ambulances in World War I that really were pretty much wagons and cots. Yeah, they had like the field hospitals and stuff in the Civil War and all that, but it kept progressing. And they put nurses out there, but then they realized, Korea is where we started seeing the helos, the helicopters, and field medics being attached to the units, and then it came out to us. So, in 1966, there was a paper published called Accidental Death and Disability, the Neglected Disease of Modern Society. It established EMS. You know what it looked at? Traffic incidents. That's what really started a lot of it, traffic incidents. That's why EMS falls under the NHTSA. We fall under the Traffic Safety Administration. Would it not make more sense for EMS to fall under medical or even Homeland Security? They talked about this, they talked about changing it, but right now, we fall under DOT and the Traffic Safety Association because it started with looking at all the wrecks. Now, what do we think we know about wrecks in the 60s? Let's think about what were cars like in the 60s?
No airbags, lap belts.
No airbags, no lap belts. speed limits, not
They
really.
stop next to whatever they wanted.
Yeah.
Kids rode in the back window.
Kids rode standing up in the front seats. If
Mm-hmm.
they were, babies would. So,
Now, hang on, you can still drink your beer and drive home from work back in the seats.
probably. I wasn't alive back then, so I'm not sure, but I'm not quite that old. But,
I assume.
so they looked at, and they're like, what can we do? And they reached out to the military, and they're like, hey, field medics do this. And then in the 1970s, the Department of Transportation published the first EMT training curriculum. Y'all, it was like bullet points, do this, do this, do this, do this. I actually know a medic that went through EMT in the 70s. She still works on the truck with us. Morgan County had 5 people, I think, that went through EMT in 1978. And one of them is still volunteering today. Bill Petty. So in 1973, they created the Emergency Services Act, which kind of created the ambulance services. This is where I say it's really good to look at that Freedom House, because Freedom House really outlines, they were what EMS systems were based off of. Some of them started off as, like hospital orderlies. The one, which weren't even like, they had no training. They just moved people from place to place, basically. And then they flew them onto the ambulance because they had some patient experience. They did have hearses. Let me ask you, how safe do you feel knowing that the hearse is coming to pick you up because you're hurt? What do you know about hearses?
They make 2 months bypass the hospital.
Well,
Carry dead folks.
you carry dead folks. Anybody ride in the back of the hearse?
Not unless you dead.
Well, that's what I'm saying. So the hearse is coming to pick you up. They can't ride in the back and provide any care for you. So they just load and go. They throw you in and drive to the hospital, balls to the wall. Anybody ever watch Mother Jones and Speed? It's on YouTube. Just watch clips of it. It's interesting. It's EMS in the 70s. It's kind of a parody, but there's a lot of reality to it as well. In Philadelphia, the police transport wagon might come pick you up as the ambulance.
Dude, I'm hurting. Am I going to jail? What?
Then they started putting surgeons on them. And the surgeons were coming in the police transport wagon. They'd sweep out the ER and pick up like the ER doctor or the surgeon and go to the call. So at least somebody's in the back of the truck trying to take care of them, right?
It just took 15 extra minutes to go to the hospital first.
I mean, we're getting there. We're getting there. Then they started getting the transport, EMS transport. In 1971, AAOS published the first EMT textbook. You are now on the 12th edition. So, 1970s, you had the EMT standard curriculum. Then in the 80s, we started getting advanced levels of EMTs. You weren't just basics anymore. Now you were medics. In the 1990s, they created the agenda for the future, which is, hey, this is how we want to grow. And in 2019, they created the agenda for 2050, which is, this is where we want to be in 2050. Mike, when you first started working on the ambulance in the 90s, did you have to call for orders for everything?
Oh yeah.
You could not put oxygen on a patient without calling.
No, I could put oxygen on, but that was it.
When my dad started in the 80s, you had to call for permission to put oxygen on a patient. Oxygen, y'all. And now, we got medics that are pushing the drugs to paralyze somebody and put a tube down their throat to breathe for them without orders. Because in our protocols, well, in the critical care protocols, but you'll get my point.
Well, I never thought we'd get pain management. I mean, it was that's leaps and bounds compared to where I started.
You know, when I started, we didn't get aspirin for chest pain. We gave it for strokes. I mean, look at how far things have come. And that's just just in the 30 years that he's been doing it, the 20 years that I've been doing it. Heck, in the last 5 years, easy, how many changes did you see between getting your basic license and now you're a medic? You've been in different states, so how many different changes, I mean, could you imagine having to keep up with the protocols for each
And-
different state?
I got my EMR, EMT, and my advanced stuff through Atlanta. That is where I started, was in Atlanta.
I'm sorry.
Yeah.
Yeah.
In Georgia, EMTs cannot do CPAP at all. They cannot even touch it.
Well, at Texas.
So Texas is fun. Texas, each individual service has a medical director that creates the protocols for that service. So, if I worked for Decatur, and I worked for Grace, and I worked for Lifeguard, each doctor could have a different set of rules, and I had to know which one I'm on by what shirt I got on that day.
Okay, say if you work for Decatur, and you picked up a call for.
Nope, I'm in a Decatur shirt, I have to do what Decatur protocols. How about this? And Mike, correct me if I'm wrong, when I worked in Lauderdale, if we had a Tennessee license, we had a cabinet.
Yeah.
But if we cross the line into Tennessee, we can now unlock this cabinet and do Tennessee skills. Cause Tennessee has different skills and protocols than Alabama does.
As long as the call originates in Tennessee,
Mm-hmm.
you
So
can do
you
that.
Kind of like Dry Creek, if you've ever been down there in Waterloo.
Yeah, that's what I'm saying. I worked Rogersville, so if we went over the county line and,
Green Hill.
Logan or Anderson, or the state line, we could do like Tennessee medics, we could have Tennessee.
Cause basics in Tennessee, can start at least where.
If you have, you can.
If you have the IV, yeah.
Yeah. Crazy, right? You have a national curriculum, but your state or your medical director can change it. So, we have the National EMS Scope of Practice model. We have, laws, we have EMS protocols and the EMS rules. We have both of them. Those typically update every 2 to 3 years. The new updates are coming out this year. I'm just waiting on the legislature to approve them so I can start teaching them. And then locally, you have a medical director that provides oversight. So the services have a medical director. Did y'all know 911 has a medical director?
Huh?
911. Get EMD certified, you have to have a medical director that signs off on your, EMD protocols. We also can call for online medical control, which means we can call a hospital and whenever ER doctor is there, can give us orders. In Alabama now, as a medic, the only thing I have to call for orders on is pretty much intubation of a child under 1 year old. Everything else is in my protocol. Are there some things that I still call because I believe in CYA 100%, but you don't have to, the protocol says we can do it.
So my supervisor still calls the hospital to double check. Like, hey, we have a 28-year-old female. She's acting erratic. She's, like, she's running from us. She's hitting us. Like, I want to give her ketamine.
Are you okay with that?
Are you okay with that? And are you okay with this dosage? So don't be scared to ask for help or ask advice.
And you wanna talk about, agency protocols? At Decatur, we have to call either the supervisor or a doctor to approve, a patient refusal. And it's another CYA thing, you just have someone else listen to you and say, yeah, I agree with you, yes.
On the fire department side, how do I obtain one? Technically, with the cover of my own ass policy, and not just doing it the Jeff Bernie way of, cancel it, be fine.
You
If-
can call it off. You can wait till I get it and let me get it, if you don't have time.
That's what, if they're gonna refuse treatment, I'm letting them get it.
If you're not an EMT, you don't have to get a refusal. If you're at the EMT level, you can document that the ambulance service got the refusal, or you can get a refusal yourself. And you can call a doc up there. You guys could call Marshall North or Decatur, either one, or Huntsville or whoever.
It's always better to call and ask for a second opinion. I have no problem with coming out, even if you tell me, like, you call me on the text and I'm like, hey, I I really think they're gonna refuse, but I prefer you look at them. I'm okay with that.
If you're in an area where we don't, in Morgan County, where you don't have radio or cell phone service, and you're wanting to get somebody, there's a TCC channel on there that you can go to, and you can call TCC and get them to connect you with anybody.
Trauma communication system.
Uh,
Mike, it's in our radios, I don't know if it's in all of them.
I don't
Already
think
in
it's the
electrical
fire
work, to be
radios.
honest with you.
It should be in the fire department radios.
Like, when I moved from Morgan County to Warren,
not really.
He has one.
Should be in Bank B.
Both of them are gonna be, each one will be, each department's is, programmed different with it.
Yeah. But it's there, if you don't have it, I think it's
Well, even if you can't get a hold of TCC, but you still have radio signal, you can always just get a hold of dispatch and say, hey, get me in contact with the medic unit.
On your,
Well, they can patch you through to the here to talk to the doctor.
Yeah.
Um,
There's always a way to contact someone for help. No matter,
a lot of people don't like the policy of calling for, a refusal. It has saved me in the past from lawsuits, claims accepted, people don't want to complete. So I like having that second opinion.
So like in our situation that I've ran into, most of the time we have medics show up with Greg. But like the other day, the lady got hit by a car, at 5 Points. So we had just a basic BLS truck show up, and Gunner ended up riding in with them because of her major injuries. So,
That's perfectly fine too.
you know,
No, it's not in his either. I don't know why the county trucks don't have it, or the county fire
But
units don't have it.
It's all
Your
good.
vault, are y'all ALS too? ALS one?
we're about, about to be getting there, but.
Yeah.
Biggest common,
Two
correct.
ALS personnel but the
What the
volunteer
hell's
department
biggest
can
common?
get
I
ALS.
don't know.
ALS non-transport. You can get ALS transport.
Wait, hang on, wait.
That may come as much
I
as
just
that
saw
costs.
something. What is that?
Yeah, I know.
It's crazy.
EOC.
That's EOC.
So,
Emergency
Madison
Operations
County
Center.
County
Oh,
policy.
That's down in the basement of the
In
courthouse.
Morgan County, giving a transport.
So what bank are you
the-
on?
Out of
the
Bank
ALS
B.
Non-transport.
Go to Bank B.
Falkville's got one, Motatta's got one, Somerville did have one, it's probably gonna get that.
Barnett,
Y'all
Tech,
are working on one, you get a couple more advanced.
I'll talk to you after.
Blank,
Okay.
Rest of those are all blank.
Blank. No, there's another one in here.
But, so,
Yeah,
it all works together, this is
Yeah,
like the
well,
system, because you
that's
have your
like
national protocols,
For
your state and your local.
if y'all are working with another
They all have
fire
to-
department or
Everything is
something, it's
based
not
off
on
the
this system.
national, the state
They'll
gives
send
you
you
a
that
little
and
more, a little bit
they'll
less, and
put
your
theirs
local
in
gives you a
there.
little bit more, a little bit less.
They can
Like I
connect
said,
all that stuff.
locally,
Yeah, that's
we
PS
call
common.
to make sure refusal is okay.
And then,
That's our company local policy, not everybody has that. But, and some people hate it. But it, like I said, because it has saved me
Yeah, I don't know
before,
why it's not in
I support it.
Hmm.
So, yes.
TC or 911 can link you up
Yeah. and put it on the,
and put it on like a back channel or something.
Yeah.
I can't force someone to do it.
yeah, dispatch to that.
I document it.
That's what I'm saying.
That's what he was saying, dispatch can tie us in.
Yeah, you can connect it.
If not, I try to get one of my volunteers.
So,
Or family members, we can do it through the house. Yes, sir, you do.
Shit, I want to see
Sign on the witness. And we have spot in our computer system that we can document if they refuse to sign and why, and have a witness sign in that spot on our computers. So, we're lucky because, they saw that we needed that. So, we were just refusing to sign. And I'm not gonna fight someone and take them to the hospital, if I can help it. I don't really like fighting in the back of a 6x6 box, it's not very much fun. So, we're training more and more people in CPR now. Once they started doing hands-only CPR, people were more willing to do it. I mean, think about it, you wanna put your mouth on a stranger's mouth? I don't wanna put my mouth on some people I know's mouth, I definitely don't wanna put on a stranger's mouth. So we started teaching hands-on CPR, AEDs became more readily accessible. Think about it, they're at Walmart, they're at churches, they're at schools, they're at the grocery store. Y'all, we had an incident in Decatur where one of the grocery stores had one. They saved a life with it. Every grocery store in Decatur went and got AEDs installed.
But we,
There are apps you can get that tell you where the AEDs are. Nelson, there are certain areas, we don't have it here, but when a call went out in Crossville that said there's a man down, everybody in the general area would get a notification that would tell you where the closest AED is. You can go pick it up and go to the house and start CPR until an ambulance or fire department got there. Works really good in big cities if you think about it. We're a rural area out here, it wouldn't work so well, but think about Birmingham, New York, Los Angeles, Chicago, big places like that, knowing that there's an AED available. There are some countries that can send it by drone. They will send you an AED by drone with someone to talk you through how to do CPR and use the AED, like Skype. I think it's an awesome idea. Think about, just think about Wyoming. Take you an hour to get an ambulance. Closest hospital is 2 hours away. If the 911 center could send you a drone until the ambulance got there, it had an AED on it, how cool would that be? Then again, I'm scared of who might be driving the drone, but, the concept is a good concept. Let's train people how to do it. The more people that know CPR, the better chance of survival. And that's our goal, right? Survival. A lot of law enforcement are trained as at least EMRs. Volunteer firefighters and paid firefighters, like we just said, 95% of the calls now are EMS. How many fires do y'all have last year?
25 house fires and 198 medical calls.
Have y'all been on staff to do about that? My volunteer fire department had 1,496 calls last year. 1,000 of them were medical, if I remember what they said correctly. So yeah, that was 500.
It was probably more than that.
That includes weather related, like trees down, lift assist and things like that. 1,000 medical calls out of 1,500 calls. I mean,
I wanna say we had 1,300 calls last year with less than 100 of them being true fires, most of them medical assistant rates.
yeah. So, people are getting trained in it. Immediate care. So EMRs provide that care, they initiate it, and then they help. When the EMT gets on the scene, they can direct them on other things to do. They provide that BLS care with limited equipment. EMRs basically have a pair of gloves and a wheel of help. There's a little bit more to it than that, but y'all know what I'm saying. EMTs, hey, you got a jump back. We're doing a little bit more here. I am not knocking it. I want y'all to know I'm not knocking it. I'm saying we're starting with very little and working our way up to everything. But those people that have very little are the ones that are getting there first and starting the care, making the difference.
Y'all, we're gonna be here in class and in clinicals close to 200 hours. By the time you do your classwork, your skills, your clinicals, and the online homework and stuff, we're looking at close to 200 hours that y'all are putting in. As a medic student, I did close to 500 or more. Actually, I know I did. I think it was closer to 700.
I was supposed to say we did 400 hours of clinicals alone in paramedic school.
I think. Y'all know how you take over care. You might be the highest level there. That's okay. As we said, what I'm going to teach you how to do a patient assessment is the same patient assessment a doctor's doing. The difference is you're doing it on the streets with little to no help. Advanced EMTs, as we said, they got a little bit more training. They can do IVs, they can do some more airway adjuncts, they can do some more medications. Paramedics now might have close to 1,000 or more hours of training. Continuing education wise, as an EMT, you will have to have 40 hours. As a medic, I have to have 60. As a community paramedic, I have to have 100.
Is that online skill, like, can we do online classes to keep that up as well, or does it have to be in person?
You can do online, you can do in person. I strongly suggest at least some skills,
Right.
especially the stuff you don't do a lot of. As an EMT, that's not as much. You know, the one thing you probably need to practice on more than anything else is blind insertion devices, because you're not gonna do it a lot. And so that's something. And I'm just saying at the EMT level, blind insertion devices and CPAP are probably the two biggest things that you're not gonna do a lot, but they are, what's it called? High acuity, low, occurrence skills. So 911. We have what? 3 different counties, 4 different counties of 911 sitting here. You listen to at least 2 of them at the same time. Night and day difference, right? Y'all hear us or do y'all just hear Lawrence?
I was just Lawrence County, but I work with Danville, so I know,
Okay.
yeah.
Night and day difference.
Night and day.
Do you hear anything? Do you hear any of them?
Not anymore, I do.
Night and day difference between what you're hearing. Night and day between the dispatchers. They all have the same training and night and day difference. Just like night and day difference between providers. Here's the big thing. Dispatchers should be EMD certified. I want you to think about that. But what they're telling you is based on the information that the caller told them. I can tell you, I have got on scene, and what the dispatcher told me was going on and what's actually going on had nothing at all related to each other. But the caller told the dispatcher that. That same patient will tell the nurse and the doctor a different story. But it all is on what someone tells the dispatcher. So don't get mad at your dispatcher. At least not for that. There's plenty of other stuff to get mad at your dispatcher for. As we were talking, there are mobile apps to assist with CPR and AED location. AHA actually has an app out there that you can turn on that will walk you through CPR. The AEDs now have metronomes in them, so they count for you. Human resources. We are those human resources. We're who's providing the care. Medical directors. They authorize EMTs to provide medical care in the field. They can act as a liaison. They are supposed to, in Alabama, have a certain certification to be able to be a medical director. Most of your ER doctors have that certification, or at least they used to. It was kind of like state protocols to work in Alabama. You had to take, like, if in the ER, you had to take the medical director stuff so that you could, when you called for orders, they didn't have to go hunt a doctor down that could give you orders. Any doctor could do it. They will establish medical, like they can change the protocols up a little bit. I will tell you that lifeguards medical director has total different set of rules than Decatur's medical director does. Totally different. Our medical director's like, just call the ER, it's cool. Lifeguards wanted you to call him. He didn't care if it was 3 o'clock in the morning, he wanted you to call him and get orders from him.
Sometimes I'd call him and hear in the background.
Club or whatever. I mean, it's a little odd to me, but hey, if that's how they want it done, that's how they want it done. Medical director is also the person that's gonna help protect you. If you got a problem with something and you wanna talk about it, go to your medical director. I had a medical director in the past pull me aside and talk to me about a call. He goes, why did you do this? And I told him. He said, well, did you know this? And I was like, yes. He goes, did you know this was gonna happen? No clue. Okay, now what are you gonna do? I'm never gonna do that again because I didn't know this was gonna happen. Now that I do, it's not gonna happen again. He wasn't mad. He took it as a teaching opportunity. I've had medical directors that I've had complaints filed on me. I took it to the medical director and he handled it. Y'all, I had a firefighter complain because he would write a complaint on me every shift. I finally went to my medical director instead of my operations manager, and the medical director nipped it in the bud. so everybody complained on me every shift. And I got tired of having to write the rebuttals. Cause we had to write a rebuttal every time a complaint was filed. Every shift, y'all. Every shift.
Yeah, Rachel, it was 3 times different shift, didn't he?
Hey,
He has a very good point, Rachel, we can't argue with that.
Medical can be online or offline, so standing orders, training, supervision. We have a medical director for this classroom. We have to have one. He may come in and do some of the skills with us. Your final checkoff for medical director, maybe. Yes, sir. He may come in and watch us, but he's not our medical director. Medical director is a doctor, I know. But yeah, he may come in and, he may come in and watch some of them. But our medical director is Dr. Mitchell at Decatur, and he may come in periodically and just see what we're doing, check you off on skills, see if you have any questions, any of that. The online medical direction is when we pick up the phone and call, phone or the radio and call and talk to somebody. Legislation and regulation, we are waiting on the Alabama state protocols to be approved by the Alabama legislature before they go into effect. So we're waiting on the legislation to come back into session. Once they approve them, they will get sent out to the training officers. We will teach everybody and they will go into effect probably in April. That's why I said we'll probably do them towards the end of class, because you'll be getting ready to use them, so we'll do them then. Senior EMS officials. So, state level, the state office of the EMS, they handle, some of this. The operations managers handle some of this. Supervisors handle some of this. Y'all have NIMS? Okay, you're gonna take NIMS as part of this class. It's incident command courses. If you haven't, you just bring your certificates.
Which one do you need?
1, 2, 7, and 8.
Okay, cool.
Scheduling and personnel, budgets. Let me tell you, the biggest headache in EMS is a schedule and a budget. Probably schedule ahead of the budget, because the schedule is what affects the budget a lot of times. Think about it. Do you have a spouse? You've seen how many? Need shift covered. Need shift covered. I'm sure you've sat with Gunner. Need shift covered. Y'all send out need shift covered all the time too, I'm sure. You don't have to deal with that. Unless
It's
you
on the
get
get.
complaining about it. Vehicle maintenance is up there too. Y'all, they break down. Their vehicles. They're running constantly. Does your personal vehicle break down occasionally, even if you do maintenance on it? Yes. An ambulance is just another vehicle.
That runs 24 hours a day, and they hand the keys to some caffeinated 18-year-old fresh out of EMT school.
Yes,
Or
sir.
as I call it, substitute.
Greg Randall,
Mhm.
it gets frustrated, like some of us, y'all keep turning up stuff, we need to be careful, that costs a lot of money,
Yeah, but sometimes it just happens. I mean, you can't help it if a belt broke going down the road.
Oh,
You
yeah.
can't help it if a tire blows.
I understand.
Or a deer walks out the road.
Y'all,
That happens a
yeah,
lot,
so we had a
Or
crack in the
cow.
windshield. Do you know what the crack's from? Where it was icy and we turned the defrost on and it cracked the windshield.
We should didn't hit a cow.
Poured hot water on the windshield. And so you have to be able to work with your ER, you have to be able to work with your doctor's offices. You need to know where to transport your patient. I'll tell you right now, burn patients probably need to go to Birmingham. That's where the burn center is in Alabama. You need to know that.
You don't have anything in Huntsville?
Their burn center is in Birmingham. The next closest one is Vanderbilt. The next one from there is Erlanger.
Huntsville can do everything except burn.
They can do cardiac arrest.
Huntsville does not like to do hands. They would prefer to send hands to Birmingham, and the eye center is in Birmingham. Birmingham's where most of the stuff is. Actually, does USA have a burn center?
I have no idea.
I think Birmingham's on the place where the burn center is.
Mm-hmm.
I knew we always flew burns down to Birmingham. I didn't know, are you talking like hand crushes and stuff?
Yeah.
Okay.
Mobile integrated healthcare or community paramedic, that's beginning to become a bigger thing. Alabama's still working on it, but the goal of it is to prevent transporting to the hospital. try to treat at home to do the preventative actions. So let me come to your house and help you look and see if there's any fall hazards, any trip hazards. Are you taking your, do you know why you're taking your medicine? Are you taking it correctly? Because I love doctors. I work with them every day. They don't have the time to explain all that sometimes. So that's where the mobile integrated health comes in. Mobile integrated health fills that role between home health nurses and transport medics. And the goal is to keep people at home. It really kicked off during COVID when they started doing ER at home, where you had standing orders to go in and treat certain things to try to keep from transporting patients to the already overloaded ERs. And you think about an elderly person or someone with a compromised immune system, do you really want to take them to an ER and expose them to everything that's in there? No. Community paramedics have advanced training, had to take a different test, and have to have 100 hours every year, or every 4 years of training. Information systems, we have CADs, active 911, text messages. I know there's other systems out there.
Chief 360 is what we run.
Yeah. Electronically stored information can be used to provide care. Think about the vial of life. Some houses still have the vial of life. You know, you put a sticker on the door and you go reach in the refrigerator and pull up the medicine bottle that's actually got information about the patient in it. Some of it's digital. Think about the new bracelets, like some of the medical alert bracelets. You flip it over, it's a QR code, scan it, and now you got your patient information. Is that helpful? Yeah.
Speeds a lot of things up.
Your medical director is going to do quality control. I hate QA, QI, but we have to do it. That is, where we review calls, review cases, review, reports, and make sure that they are done correctly, see if there's anything falling through the cracks. Certain things get, put up to the, medical director. Just culture, try to make everything fair. Is that always possible? No, but we do wanna try to make it as fair as possible. That QA, QI, we have a set list of things we go through, things that we're looking for. This is why they like a certain type of, documentation, because it helps hit all the points that you wanna make sure that you hit. The goal is to minimize errors. Here's the thing, if you made an error, document that you made the error, don't lie. But if you made an error and it was a major one, someone's gonna come and talk to you. Do you know how many times I have documented the wrong medicine, administration? I gave the right dose and documented the wrong thing. It happens. Did I get talked to? Yes. As long as I'm not, documenting that I gave 1 milligram of something and putting 5 milligrams in my pocket, that's another big problem, right? So the QA, QI is trying to look at all that types of stuff. Patient safety, that's a goal. Our goal is to keep the patient safe. We want to minimize errors. And everybody's watching. I'm an FTO educator. My job is to watch my others and to train people to do the right thing. My supervisor's watching me. The director's watching him. The hospital's watching him. And it goes like that. System finance, they vary on your organization. I'll do a quick comparison right quick. Morgan County gets more than Lawrence County does, volunteer-wise. Just because some things are set in place differently. Legislature changes and things like that. Does that make it easier or harder? Yeah. Morgan County can typically get a little bit more equipment than you can because we already have money that you may not have. And I say we as in the departments as a whole, not, now, if you're on the truck, you may be asked to gather the insurance information. You know what we always forget to get? Vehicle insurance when they have a wreck. Vehicle insurance always pays. You're supposed to be getting that. We gotta get signatures. You may have to get permission to bill. You may have to explain that you're going to bill. When you hand the patient off to the ER nurse, they have to sign saying they're taking care of your patient. There are some volunteer departments now that make the ambulance sign that we're taking care of the patient. When I put a patient on a helicopter, I have to sign that it was medically necessary for the patient to be on the helicopter. It's just things they do. ET3 is no longer in effect, so you should not be tested on it, so we're not gonna touch all about it. Education systems, so, I have to be licensed. I have to hold one of, I think it's there's three different types of, instructor certification that are recognized in Alabama. You can be a fire EMS instructor for the fire college. You can be, a DOT instructor, that one's getting phased out, or a, NAMC, which is National Association of EMS Educators instructor. You have to hold one of those instructor certifications. As an EMT, you can teach an EMR or an EMT. As an advanced, you can teach an EMT or an EMR or an advanced. As a medic, I can teach medic, EMT, AMT, whatever. To teach critical care, I have to be critical care. You have to hold at least the licensure of what you're teaching. Makes sense, right? I mean, you wouldn't want someone that's not a firefighter to teach you how to be a firefighter. So you wouldn't want someone who's not an EMT to teach you how to be an EMT. We follow national standards, we follow local standards, have to do continuing education. In Morgan County, we offer a free class every month that gets you 2 hours. I do training here, which gets hours. There's online classes all the time. Some places sell it, that phone frat, while they do have free stuff that you can get, they sell refresher classes. Impact EMS sells refresher classes. There's other places that do it. There's other places, kinda like we are here at Direct EMS, that have training programs that they do. And, they will help you with continuing education. Prevention and public education. We want to try to prevent something before it happens. So, say you're doing a ride along and you take a patient home and you see something that could be a problem. Bring it up and see if we can fix this. That's perfectly acceptable. We wanna try to teach the public. That's why we do Stop the Bleed, why we do CPR and AED training, why we do stroke training. They've got the new, Narcan training that's hitting TV out. We can have a discussion about that at any time. I want to make sure that we're giving out all the information, not partial and the truthful information, no matter what we teach. Vaccine programs. What about, y'all ever do days where you just go out in the community and have it set up for them to come to the fire department and get like blood pressures and blood sugars checked? Some of the pain departments do. My daughter wants to set up a community day where we have police, fire, EMS, dispatch come in and work with the public and tell them what we do. That's something she's wanting to set up. I'm like, more power to you, baby. Then she wants to have a panel where you can ask questions and like everybody give their input. I'm like, you're scaring me, you're 14. But things like that are out there. Prenatal screenings. Tobacco use laws. As much as I'm not a fan of them, you know, New York has laws on how big of a drink you can buy. If it's like a Coke, you can't sell like 40-ounce drinks in New York. 20 ounce I think is the biggest you can sell. It's taxed at a different rate. So no cigarettes are taxed different than like food and groceries, right? They're called, they have, I don't remember what they call, but they have taxes on stuff like cigarettes and alcohol. The states that sell marijuana, they're taxed differently because they are not the healthiest things in the world. Research, as I said, we research, and that's how we change things. If you notice something in your area, talk to somebody and say, hey, I've noticed this going on. I'll tell you this, after COVID came out, we started seeing stuff, we started talking to our doctors, we started documenting things. And there's been a lot of post-COVID research that came out. There's been research before, but COVID changed the world. Y'all all know pre and post-COVID world. We look at the National EMS model. There's a National EMS education standards. If you want a copy of them, I would be glad to let you see them. That's what our stuff is based off of. It's what the book is based off of. Rules and regulations, they protect you. The rules are there to protect you, not to hinder you. Keep your vehicles and equipment ready. Ensure safety. Wear your seatbelt. Now, do I like that the little camera barks at me if I don't have my seatbelt on to ride across the parking lot? No, but it's there for a reason.
My name is Sandra.
You guys are going to learn about getting your equipment ready later in the semester when we get to dealing with doing scenarios and that kind of stuff. There's a blue bag over there that's an EMT bag. You guys will have access to that. You'll be assigned a crew that'll be responsible for making sure that bag's got everything it needs in it. We'll have a checkoff sheet and all that kind of good stuff on it.
You'll be
There's
given a radio.
2 radios over here that we'll be handing out to the crew, and at any time during the class you could be dispatched on a call.
And
It'll be something like in the parking lot or something like that, but you'll be dispatched on a call to go provide patient care.
so going off of what Mike said about checking your stuff off, check your truck off. Check your truck off.
Check your bag.
Check your bag.
Check your drug box.
Check every single thing you get.
And guess what? Check that the fuel is full.
It was in the county, me and one of my partners, I picked up a night, I never picking up another shift again. I swear. We got dispatched to a sick person alpha. Okay? No fire shows up. Oh well, it's an alpha call, we don't really care. It turns out to be a full arrest. In a basement, in a very, very tiny bedroom, a very little room. Neither one of us checked the bag. There was no drugs in the bag at all. It was completely brand new. None of us checked it off.
Check stuff.
Check your stuff.
Be familiar with your stuff. We try to set our trucks up similar. Most places try to set their trucks up as similarly as possible. But when you get there, go look at the truck. Get in it and make sure you know where stuff is. When you get on scene, you may have to provide the leadership. No, you're all sitting there going, me? There was a story told to me about a medic. She was a new medic. She got on scene. They said, what do you need? She goes, I need a medic. They said, you are the medic. She said, well, get another one because I need another medic.
I need a more medic.
Yeah. Instead of I need adulty or adult, I need a medic or medic. Look at your scene. Y'all, your scene size up goes from the minute you're dispatched. You know the areas in your coverage area that you don't go to alone. You know the ones in your coverage area that when you get there it's gonna be something else. There are roads that when the call pops up I say, oh, it's either gonna be a domestic or an overdose. And 9 times out of 10 I'm right, it's a domestic or an overdose on certain roads. That sounds bad, but it's the truth. So make sure you're keeping the scene evaluation. And guess what? It never stops. Your scene evaluation is constant. One of the things that I like a lot of times, me and my partner, one of us will be doing patient care and one of us will be watching the scene. And I know where all my exits are and no one gets between me and the door. That's just rules. Also, if I'm running, you should probably be running too. Because I don't run.
Wanna take a break?
Yeah, let's take a break.